Hi, welcome back. I'm Dr. Margaret Ames, and you're listening to Your Dental Health. The goal of the show is to get the word out about biomimetic or minimally invasive dentistry. Bio is life, mimetic is mimic. So I want to tell you about a couple of patients that I saw this week it just is more exciting than people say to me, you better get a life because you like this stuff too much. But I'll tell you about a few of my patients this week. One of them was Annette. Annette is a great patient. Her home care is great. She doesn't need a lot of dentistry anymore, so every once in a while she does. But she was in this week, and she has some teeth that grew into her mouth at 9 years old and 11 years old, and they got cavities. I mean, these are virgin teeth that never had decay before in her life. She's 80 years old. She has these great teeth. So why did she get this decay between her teeth? Let me tell you about decay between your teeth. If you have decay in the top of your tooth, it can be air braided out. Just buzz the sandblaster and you take it out. Don't need any Novocaine unless it's really deep. If you have decay on the cheek side of your tooth, the kind that you can see that touches your cheek, like on the back teeth, you can use the air braider and go in there, or the drill if necessary, and you can go in there and you can reach it. What happens when decay is between your teeth? Your teeth touch each other. Imagine them being a little bit like beach balls, the back teeth, the molars. So if you sat on a beach ball and put pressure on it, you'd flatten out the top and the bottom, and you'd have some bulging sides. That's basically the shape of a tooth. So if you have two molars next to each other, they're tangent. Remember that word from geometry? They are touching each other in one spot. It's very common for the bacteria to go just below that touching spot and cause it decay. So it's nearer to the gum. That's why we always stress flossing. We teach you how to floss. We teach you how to floss in 90 seconds. Most people don't floss because it's too time consuming. Nobody ever showed them. I had a hygienist that on every patient's chart after she was finished, she wrote stressed flossing. I said, you can't just write stressed flossing. You have to show them. If they knew how to do it, they'd be doing it. So we're there to coach you. So come on in. I have two wonderful hygienists. I always say, if I ever had stayed being a hygienist, because I was an assistant and a hygienist, I would want to be as good as they are. They are unbelievable. I'm so blessed to have these people in my life. So anyway, if you imagine this beach ball and two beach balls next to each other, and the decay gets in between because you didn't floss, didn't brush really well. How do you get to that decay? You can't put the air braider in there. You can't put the drill in between there and just get to that one spot where the teeth touch. So you have to go from the top of the tooth down, the biting surface down, and you have to drill away a lot of healthy tooth structure so that you can just reach that little bit of decay. It's so sad when I have to do this. I tell the kids, you have like jewelry in your mouth. They're better than pearls. And with the amount of money that your parents had to invest in their own teeth, if you don't have to do that, in some cases, their parents, sometimes the older people can be healthy too, but there are people that have had catastrophic failures, had crowns, root canals, teeth that had to be extracted, root canals that failed and needed surgery at the tip of the root to save that tooth. It's so sad. So I tell the kids, you have a gift in here. You got to hold on to it. You got to take care of it. So I do all in my power to not have to drill away any healthy tooth structure as much as possible. So I was telling you about Annette. She's 80 years old. She comes in. She got decay down by the gum line because as you get older, your mouth gets a little dry. And dry mouth, whether it's from age or medicine or stress, promotes cavities. The saliva is there to dilute the acids that the bacteria produce. The bacteria eat the food that you eat, and the simpler the food, the more easily they eat it and produce the acid. So if you don't get the food off once every 24 hours, the bacteria will consume it and give off an acid which stays on your tooth and eventually decalcifies the enamel. And the enamel's weak and chalky, and then they go in further and they infect the inside of your tooth. That's when it's a cavity. So on Annette, I was able to, because of the location of these and because she's a great patient, I gave her a drying agent, and I was able to have the gums not being exuding any fluids. I was able to get in between the teeth and underneath because it was a root cavity, saving her from having the tooth cut in half. Because if you look down at the top of the tooth, you see a surface that is for chewing. And there's like, imagine a ring on the top of that surface, the part where you chew. If you violate that ring, you're weakening the tooth. You're actually cutting it in half. So you have to get down to that place in between the teeth by cutting away healthy tooth structure. So that's one way of doing it, is if you're lucky enough, if the patient is lucky to get decay in a certain place and I can reach it, I can get great results by giving the drying agent and minimally cutting away only the part that's decayed. Now, there's another thing which is relatively new. I've been using it for about 4 years. That's relatively new in the scheme of dentistry. It uses infiltration. So if I catch the decay early or the decalcification very early, I can go in there between the teeth with a little shield, a piece of plastic. Now, by the way, if you've just tuned in, you're listening to Your Dental Health, and I'm Dr. Margaret Ames. I practice in Huntington, Long Island, and my telephone number is 631-261-4525, and my website is drames.com. That's drames.com, and you can email me there at drames@drames.com. So where was I? Back to the infiltration concept. So what I do there is I have the patient come in, I put in a little orthodontic spacer. They come back in a couple of days, there's room. I can put a piece of plastic down in between the teeth and put a conditioner that will clean that tooth so well and kill any germs that are in there. Clean that up. It's a very involved process. It probably takes as long as a small filling. However, I don't violate that circle, that rim that holds both sides of the teeth together. I don't have to drill down through the part of the tooth that's healthy to get the decay. And let me tell you, I had another patient in this week. Her name is Gail. She's a hygienist, and she's a wonderful person, very smart. She's also looking for a job, but I don't have any openings right now. I've had the same hygienist for many years, I'm happy to say, but Gail is great. So Gail had this infiltration concept material used in her mouth a few years ago. She got a few small pits on the biting surface. Now she's an adult. Her 6-year molar grew in when she was 6. Now she's probably in her mid-40s. And I didn't have to violate the part of the tooth and cut it in half to get in between the teeth. And now I use the air abrasion. Didn't need any Novocaine. Air abraded down through those pits. When I got down there, I said, oh my gosh, I got this at exactly the right time. It recently became decay. Found it early using a laser light. I have a laser that I read, and it shows me if there's bacterial porphyrins. That's bacterial poop. And when bacteria are active and eating the food that you eat, their excrement is the stuff that breaks down teeth and gums. So when she was all finished, she was like thrilled. And so was I, because I was able to keep it dry, take out the decay, and only limit it to the pits. I didn't connect the pits like we were taught in dental school. You might as well just drill it all out because it's going to get decayed anyway. It's not. That's not true anymore. So it was really fun to see Gail this week. Who else can I tell you about? I wanted to tell you about, I talked about root canals a while back. So a root canal is where the bacteria get in and they reach, the decay gets so deep, it eats up a lot of dentin, and it gets into the nerve, and then it's irreversible. You can't cure a nerve right now. If you have symptoms, they're not going to go away by themselves. So then the endodontist or myself or my associate would go in there, take out all the tissue that is no longer alive, clean it, sterilize it. Well, you can't really sterilize something that's alive, but sanitize it, get it really clean, and then put a filler in there so that the body will not reject it. So that's great, lasts many years, has a very high success rate, but I still consider it catastrophic because you're taking away the blood supply to the tooth. You're taking away the circulation, the nerve source that used to go to that tooth. It's no longer there, and the tooth is destined to break down even further. And as you get older, more dentistry means more dentistry. So there's something called an apicoectomy. So an apex, remember that triangle has an apex? So the tip of a root has an apex. And the tip of the root is where we see a sign where you need a root canal. So when the pus inside from the dead tissue can't get out the crown of the tooth into your mouth, it tries to go out the apex, the bottom, the tip of the root, or the top if it's a top tooth. And it tries to work its way out, and that's what causes the pain, is that pus trying to get out. So if your root canal fails, you will have more pus there, and the surgeon has to go in from the side and clean it out. it's not a fun story. So you really want to get minimally invasive biomimetic dentistry. You really want to call me at 631-261-4525. My mission in my life, along with other values, but my mission in my professional life is to save all of your healthy tooth structure because it's valuable. It ties the tooth together. It's like tie rods. It's like if you took a piece of metal out of the George Washington Bridge, the stresses would be redistributed more to other of the rods, the girders that hold the structure together. So I'm glad that you tuned in. I hope you're enjoying your summer. I look forward to being with you next week. You can reach me at 631-261-4525. I'm Dr. Margaret Ames. And look at my website. You can see some videos of what's really going on in my practice as well as old archived shows. Have a great week.
I do. And when you give me that pretty little pout, it turns me inside